everyone. My name's Georgia Vasilakis. I'm a PGY3 and rising chief medical resident at the University of Pittsburgh. Today we have the honor and privilege of talking with Dr. Josh Levenson, also from University of Pittsburgh, who's one of the known leaders in cardio-oncology. Thanks so much for being here, Dr. Levenson.
Georgia, it's such a pleasure. I really appreciate the opportunity.
Absolutely. So here today we're going to be talking about the field of cardio-oncology. So can you tell us a little bit about what cardio-oncology is?
Yes, so cardio-oncology is a rapidly emerging field over the last several decades, really focuses on the treatment, risk prognostication of cardiac disease in patients with cancer or survivors of cancer. I think this has gone from a very niche field. Really, when I was actually applying to fellowship, I recall really it sounding just like a handful of cardio-oncologists existed, and now obviously is rapidly growing and in need of so much. So I'm excited to be here to talk about it.
Awesome. And for our upcoming trainees, residents, fellows who want to be involved in cardio-oncology, can you talk to us a little bit about what your day-to-day is like and how you take care of patients the best way you can?
Yeah, it's so fun to have trainees learn about cardio-oncology because there's no one type of cardio-oncologist, which I think is why it's a very appealing area for anyone interested in the field. Cardio-oncology, for me, I'm predominantly a clinician and an educator and an imager. So I utilize multimodality imaging to help diagnose these patients with things like checkpoint inhibitor myocarditis or standard coronary disease or valve disease. Treat a lot of patients who have common diseases, coronary disease, hypertension, when they also have cancer treatments, but also help to identify and manage the complications of those cancer treatments that are very rare, and then hopefully manage through it. But I will tell you that many of my colleagues are advanced heart failure, transplant cardiologists, and their day-to-day is very different from mine. It's fun to hear they're doing some cardio-oncology and a lot of traditional VAD or transplant work. We have others who are very focused on arrhythmias, and many are heavy grant-funded researchers, and their clinical time is actually very small. And then they're helping to get the evidence base to help guide a lot of the clinical practice that you and I utilize in day-to-day practice for cardio-oncology.
Thank you so much for that. It sounds like there's so much going on that's so exciting in the field of cardio-oncology. So given all the excitement that you've shared, what is one of your what is something that you're really excited? What is something that you're really excited about in the field of cardio-oncology right now?
Yeah, I think the main excitement remains the concept of immunotherapy and the way immunotherapy has changed cancer prognosis for all patients. I think we've seen, for example, when I was in training, only 1% of patients were getting immunotherapy, and now over 2/3 of cancer patients are able to get immunotherapy, and prognosis has changed for so many. And as a result, we are in need and are now able to really help understand what those risks are and manage through them. Immunotherapy-associated complications such as myocarditis or atherosclerotic disease went from a sense of nihilism. We didn't know that this existed and we didn't know how to manage it, now to being able to diagnose it more readily, having treatment algorithms, having inspiration from both thought leaders and day-to-day clinicians. And there are now recent cases that have just been published and discussed at the meeting of patients who've had immune checkpoint inhibitor myocarditis who are being re-challenged and then retreated again with things like abatacept. So it's very exciting to know that our patients are going to have better outcomes, and that there's a broad sense of inspiration for the field from both researchers, educators, clinicians, guideline writers, journals, right? There's specialized journals. So, cardio-oncology is great because it doesn't have to be any one type of cardiologist or CVT member. I think it's anyone who has an interest. The last thing I'll say is it's very fun for trainees to think about the field, and like many, including myself, don't have to commit. Get some exposure, get a few core concepts in cardio-oncology, may decide to go into a more traditional subspecialty, imaging, heart failure, and then evolve into cardio-oncology. And this is one of the fields that you don't have to necessarily declare immediately, may evolve over time. And we've had a lot of graduates from our program and others who've committed to advanced training, but also those who've sort of decided a little bit later on to sort of niche into it and have had rewarding careers.
Absolutely. So how would you encourage us to get involved?
Reach out. We are all active on social media. We love to talk. We are very amenable to emails, to one-on-one conversations, publish, find mentors locally, write up case reports, write up case series, get involved in research. There are journals, there's the like. So I think in any way, just get involved. But mostly I'd say, focus on the patients, try to take care of the patients. They're the most rewarding group. And so really encourage you to, if you've not been exposed, try to see cardio-oncology as an opportunity to see these patients in a different light.
Well, thank you so much to Dr. Josh Levenson for your time today. For more videos like this, check out our channel at youtube.com/FITsOnTheGo.